My name is Dr. Mickey Seeger. I'm a bariatric surgeon here at BMI of Texas, and I'm very excited. I have given many talks in this room, many talks, but none like this one tonight. There's some really new and exciting technology that we are about to experience in our field, and we feel very lucky to be able to share that with our patients. We've been looking for something like this to help us with some of the things that we do, and it seems like we're on one end or the other end of the spectrum all the time, and we have trouble kind of getting in the middle with things that we can do to help people. So as you know, what we're talking about specifically is the Obolon gastric balloon. Now, how many of you have heard of a gastric balloon or intragastric balloon, right? There's some information out there about them. There's several that have been out on the market for a little while. And in fact, we have experimented with them in our practice and learned about them to some degree. And we've kind of been shy about ramping up with that technology because there's some problems with the way that it was initially introduced. All the balloons that are out there currently on the market are filled with saline or fluid, and they're very heavy. I don't know if you've ever held one in your hand, but it can be a pound or a pound and a half of solid mass that just sits in your stomach, and it makes you feel kind of miserable all the time. So when we tried them, we had some experiences that were difficult to deal with. And so the new technology that Obolon brings to the table, and I'm kind of getting the cart before the horse here a little bit, takes that away, because instead of putting fluid, which is very heavy and boggy, it's filled with gas. So it floats in your stomach and takes up space and kind of works with what you're doing to make you feel full without making you feel miserable, right? So that's the thing we're looking for, is that happy medium, right? So let me introduce a little bit more about the practice and also talk about the device some. So this is, again, our practice, is our logo. We have several people that are key players in our practice, but before I get to that, I just want to tell you what we're all about, right? This is our mission statement. We like to think that we're here to provide innovative and comprehensive medical and surgical care to people who are struggling with their weight and metabolic disease. So we're dedicated to creating a long-term partnership with you and anyone that's suffering from this problem. This is a chronic illness. Obesity isn't something that we can go and cut out like a bad appendix or snap a magic wand and fix. It's a chronic problem. And extra weight is the same way. All the different degrees of weight and how it affects you is completely unique from one individual to the next, right? And so that's what we're about, trying to provide that environment for you that's a safe place, guilt-free and compassionate place that you can get a hold of this problem that's so frustrating, right? Because nobody ever comes to this seminar of any kind and says, well, I've never really tried anything, so let's go for surgery or let's go for this. No, everyone has tried working with a certain specific diet plan or whatever, and it becomes frustrating because the tools and the information and the misinformation that's out there today tends to lead us down the wrong paths and prevent us from getting to the goals that we want to get to. And so that's what we're going to try to do for you, is find out what your special needs are to make it successful for you, right, long term. Okay, a little bit more. Whoops, I passed up our partner, Dr. Treve Dupure. He's not here because he's operating right now on someone, and he is very sad that he's not with us, but he wanted to be. And he's got an extensive list of credentials, which I'm not going to read them all to you, but there's a few of them, highlights. There is a slightly shorter list of credentials. No, just kidding. I'm partners with Treve for a long time, and Dr. Rich Engelhardt is here with us too, who is also he's running our clinical fellowship now, and he's the chief of surgery at one of the hospitals where we work. So you have a lot of experience on the surgical side of the group. We also have Dr. Jenny Seeger over there, who is my wife, and also more importantly, she's an awesome board-certified obesity medicine specialist, and she's actually on the board and a diplomat of the American Board of Obesity Medicine. So she's very intimately involved with everything that we're doing to make the surgical piece and the medical piece get together and figure out what's right for a patient. And it's especially important in the balloon therapy that we combine the very best medical weight loss knowledge, because we want you to get the most out of it that you can, right? This isn't just about putting something there and giving you no other suggestions so that you don't eat as much. It's a very scientifically driven way that you're going to conduct business using the Obolon as a tool to help you get these results. And so Jenny's a big part of that, and you'll be seeing a lot of her along with us in the office. So a little bit more about the practice, right? We have a lot of things that we think are unique, but we're all the surgeons are fellowship trained. We have a only fellowship that trains other doctors, so we bring other doctors in for a year at a time and teach them how to do all of this stuff. So people competitively apply every year to see if they can come train with us, and we review applicants and interview them. And I'm only telling you that because it's kind of neat to get your work done at a place where people are trying to come learn how to do it so they can take it elsewhere. Again, we have extensive experience with surgery and also the minimally invasive procedures, and we are a center of excellence. So we're here to talk about overweight and obesity. So I put in a few slides that define it and just kind of explain it to you all in different terms, because it kind of has a different feel depending on the person, like what is obesity to you, or what does your weight mean to you, or why does it bother you? Well, this is extra weight that's dysfunctional, which can cause medical problems, which those can include weight-related problems, meaning the actual weight causes joint problems or sleep apnea or pressure problems, or the fat tissue itself is metabolically active, and that can cause you to be metabolically sick with diseases like diabetes and high cholesterol, a metabolic syndrome. So all that stuff can interact and be a part of the disease, right? There are many known adverse health consequences that are directly related to or causal from obesity and overweight. This is a few of the more common ones: high blood pressure, diabetes, heart disease, heart failure. We don't want you to have these things. You may have them, or you may have family history of them, but these are things that can make you really sick and even shorten your life, right? They're very, very serious illnesses. Cancer, we know now, is related directly to overweight, and some cancers are very high risk of recurrence if your BMI is over a certain weight. There are other things that we didn't mention that are also very common, but migraine headaches, joint pain, arthritis, asthma, urinary incontinence, sleep apnea, all of this stuff is related to that, right? So we know it's a problem, and how do we measure it, right? There's lots of ways that you can measure obesity. What's the number one way that you measure it? Yeah, you jump on the scale and you have this idea in your head that you should weigh a certain amount. There's actually a scientific way to kind of calculate what your weight means to you. Does anyone know what that's called? It's BMI. It's kind of cool because that's our name too. It has to do with your height and your weight. So if you're 6'8" and you weigh 300 pounds, that's different than if you're 5'8" and you weigh 300 pounds. And so BMI takes into account that calculation and matching up your height and your weight and seeing what kind of stress that might offer on your body. But there are other ways, that also very important ways, that we use in the office and as part of your treatment, like percent body fat, body composition. There are many ways to measure this. We have a very scientific way that you guys will get to use in our office as part of this program called an IDEXA scan that'll actually measure your body. You'll lay in a scanner, we'll scan it. It's the same kind of machine that the Dallas Cowboys use and the Olympians use to make sure that their bodies are perfectly fit for whatever sport they're about to play. Well, we bring that technology to you to make sure your results are maximized also. There's also measuring of weight circumference and calculation of appropriate diameters that can expose risk for obesity and metabolic disease. So what does the treatment overall look like in our practice? It's comprehensive. This is a multifactorial problem. It has multiple causes, right? Overweight and obesity is caused by genetics, environment, hormones, metabolism, stress, sleep, gut bacteria, bile salt circulation, physical activity, macronutrient intake. I can go on and on. There's over 200, right, Jenny? 200 named causes of overweight and obesity. And a lot of that stuff is not under your control, right? I mean, you can't control your genetics or your hormone balance. So all that stuff's in play, and you're trying to treat this problem that you have no access to tools that will do that. And so introducing a tool such as the balloon or some of the procedures and some of the effects that we get from the medical weight loss side can give you a metabolic advantage over that disease, and it'll help you understand how it's working, why it's working. And so that's why our treatment program is the way it is. So one of the things we ask of our patients is that we want you to have long-term excellent results. So we're not looking for someone to have good results for a year and then have slip back into something else. So we're not wanting to talk about going on a diet anymore. When you say I'm going on a diet, like it's about to be time, right? New Year's comes around and we're gonna make those resolutions and diet's gonna be one of them. Well, that implies that it's gonna be over. When you say you're going on a diet, it probably means you're going off of it at some point. And because who's been on a diet? Everybody, right? I've been on a diet. I'm on a diet currently. You get on it and you lose some weight, and then what happens? You get stuck, right? You get on a plateau, right? And you get irritated because you're doing everything right, but nothing's happening. Who's been there, right? And then you're like, well, what the heck am I doing this for? Because it's not working. And then you go and just go back to whatever you want, and then what happens to your weight? Right? You know why that happens? This is very good scientific evidence of why that happens. Because when you're losing weight on a specific diet, depending on the diet, your body can ratchet down the metabolic rate and what it's doing with calories. So there was actually a lawsuit about this with The Biggest Loser. Anyone watch The Biggest Loser? So what happened with them was, they were having these patients or people that were brought in and put on a very strict diet, and they're exercising every day and eating a few leaves of lettuce, but their metabolic rate went so down, their resting metabolic rate, because their body was trying to keep them at their set point because it thought their set point was up here. Their weight dropped, but their metabolic rate dropped. And so when they went off the diet and their metabolic rate was low, their weight went right back up. And sometimes you go up higher than when you started. And then you're really frustrated, right? So how these things work together, it depends on how you interact. And what we want to create for you is something that is meaningful and reproducible, and that you can do it long term and you like it, right? So if I tell you, I've got the solution, and you're gonna just drink pickle juice every day and that's it, and you're all good, that's not sustainable, right? We need to retrain our bodies to eat smaller amounts of healthy food. Right? And so one of the things you'll see in the studies with the balloon is when they took this balloon out, people maintained their weight because they were learning that behavior during the time that it was in. That was a powerful effect, and it was one of the selling points for me in terms of wanting to offer it to people, because all the other balloon systems, the weight went up when they pulled the balloons pretty sharply. Why? I think because it was so obnoxiously miserable that there was some sort of retaliatory effect when it came out. You're like, okay, I'm free, and let me fly like a bird. And so I think that's the difference, right? I think that's the difference. I think that's what you're gonna see. All right, so here it is. I wanna explain it to you. I want you guys to ask questions, but this next series of slides are gonna introduce this concept to you. We're gonna talk you through how it works, how it happens, and then how we go from here to move forward, right? What the process will be if you guys decide you want to do it. So introducing the Obolon balloon system, right? This is the first swallowable balloon. All the other balloons that are out there, you have to have a procedure where a large tube is placed down your throat. It's very large. You have to go under anesthesia. You have to be intubated. And they'll place it down your throat into the stomach and blow it up while you're under anesthesia. This one, you swallow it in the office. It's a little capsule, and we're gonna show you. We have some, may I? So we have some models of them. Thank you, Priscilla. So it starts, and you'll get to see video of this. This is really cool. And is it all right if I pass this around to them? As long as no one's, just don't swallow it, right? It's like a giant vitamin, and you swallow it. It's connected to this tiny little filament. Maybe you can see it against my shirt. You swallow with a bunch of water, and we do it in the office. We have a special machine that we watch it radiographically, and it goes right down your esophagus and it goes into the stomach. Once it's down there, then we connect this little tube to this special canister of special gas. It's not stinky gas, so don't worry. But it inflates that. And what ends up in your stomach is this balloon. It's very lightweight, and it floats. It floats in your stomach. This is hidden inside of this capsule. And once it's full, you just simply withdraw this tube. It comes right out the mouth, and then off you go. It takes about 10 15 minutes to do in the office. What this is doing is it's taking up space in your stomach. Now, the trick with this one is that it's graduated. So we put one in, and then we wait a couple of weeks, and then we put a second one in. So you have time to get used to that. Again, the other balloon systems, you go from 0 to right away, big heavy thing in your stomach. It's uncomfortable. This one, you put one in, and then you put another one in a couple weeks, and then a month and a half later, you put in a third one. So you end up with 3 of these in your stomach. They don't take a procedure, a surgical procedure to put in. So you come to the office, you get it done, you can go back to work. You compare that to the other system, patients are off of work for about 2 weeks because of nausea and vomiting. Okay, that was my experience with the most recent one that we had. It took a long time to get used to that thing being in there. So the comfort level is increased, right? And it's graduated. So again, what we're trying to accomplish with this is to retrain your body and you to get to something that's sustainable long term without cutting and snipping and pasting and rerouting and changing plumbing, right? So this is the in-betweener, right? This is the thing that's going to help you to get from here to there without changing your anatomy. Now, it may be that you needed that or something, but this is a great option for people that fit into those categories. And if you haven't experimented with medical weight loss before you do any of this, I certainly hope that you will. So again, it's non-surgical, takes a few minutes to do. We don't have to sedate you or give you drugs. You don't need a ride home or an Uber or anything. You can just hop in your car, go right back to work if you want. If you'd like the day off, I can write you a note. But there's no downtime. I think that's a big plus, right? I think that's a difference compared to what else is out there. They're lightweight, so they have less side effects. There can be some nausea with anything you put in your stomach. If I gave you a bunch of cheeseburgers to eat and you ate too many of them, you'd have nausea. If you fill it too fast or if you eat too much once you've had it put in, you're going to feel negative feedback. And that's part of the learning process. So what you want to do is realize what it is that you can eat before you are full and what's the right amount for you. So this helps you with portion control, and we will be modifying your diet, and that will change what we're doing metabolically. Also, we'll be working with you on the activity side. We definitely give everyone some as-needed medications. If you were prone to nausea, we would prescribe things for you that you would just keep in your medicine cabinet during the time that you have the systems in place, right? So if you look at the study patients, it was rare that people had to have it removed for a nausea or an intractable issue. Almost always do you get better. It's much more tolerated than the one-shot big saline balloon. Because you put one in and you wait till you're used to it, then you add the second one. And we say we're going to add it in 3 weeks, but if you're not quite ready, it could be 4 weeks. You know what I mean? There's not a magical that has to happen on this day, right?
Does everybody get a free balloon?
Yeah, so that's the goal, because the study showed that if you had the third balloon placed, you lost a significantly more amount of weight than a comparative group that only had 2 balloons. Now, I will tell you this. Within the study, they had no access to medical weight loss. They had no access to board-certified bariatrician. So I think what we're going to see is going to be significantly higher than what we saw in the study, because we're not just going it alone. The purpose of the study was just to say, let's fix everything at a simple level and see what the balloon does on its own. What does Obolon, just by itself, with no other teaching, do for a patient? And those results were encouraging. So when we add the other therapies on top of that, we're expecting to see much better results. I will tell you this. I mean, if you look at her patients that she's doing medical weight loss on, they have anywhere from 12 to 20% body weight loss at 6 months. Is that fair? So if you add that plus a balloon and you work with her for 6 months, which is part of what you're getting when you sign up for this, you can reasonably think you're going to have more than that. So if let's say you lost 30% of your body weight, if you weigh 200 pounds, that's 60 pounds. That's a lot of weight. So it can really add up with the multimodal therapy. Okay, so I kind of talked through this and I got way ahead of myself because I was excited, but here's some pictures about how the balloon ends up in the stomach, how we make sure that it is where it's supposed to be, and then how we remove it. You can see here the 3 floating in the stomach, one on top of the other. There is this supervised program that we'll want you to do. We also want you committed to following with the program for 12 months. While the balloons can only stay in as approved by the FDA for 6 months, we really want to see you engaged for a full 12 months to make sure that you're getting what you wanted out of it long term. And some people need more accountability. Like I said, it's a chronic problem. And we don't pretend to think we can do something magical that can make it ever be something completely that you didn't need help with. But there are patients out there who don't need additional help. And some people do. They need to come in once every 3 months or so and just touch base and make sure everything's going okay. Some people need more frequent contact. So we'll tailor that experience to what your needs are after the initial 6 months. This is a cool video that kind of demonstrates exactly what's going to happen. Now, these people remind me of like the Alien, the Alien shows. Like, did y'all see Cocoon? Like, I thought about, those old folks in the pool and the people with the light that come, but anyway, so there's the capsule entering the stomach. You will have not a bunch, but some water to drink to make that easy for you, because when you picked up that capsule, you were probably like, whoa. But it slips down, and then that outer part dissolves. We inflate the balloon, and then we pull it out. And this is the effect when you eat food, right? It's going to go down in your esophagus, into your stomach, and obviously when there's less room in there, you're going to have less desire, increased satiety. And there's some really cool music that you can probably just hear in the background a little bit. I liked it. I played it twice. So there she is. She's not going to eat that other bite. So that's showing you what you feel with that other one. And it kind of counts the, okay, insertion 1, all right. And then we're going to go and put the second balloon in, all right. And then the third balloon happens after a couple months. The balloons are removed under anesthesia. We give you some medicine to help you relax, a sedation, and we put a camera down your mouth while you're sleeping, and you just have a little needle that pops those things, and you slide them right out. You wake up and they're gone. All of that's included. Here's a couple of comments on people that have had some experience with this. Obviously, these patients were on clinical trials. The exciting thing about this is that it's new. So again, receiving the 3 balloons over the first 3 months, the first 2 right away, and then we wait a little bit of time for the third one. You asked the question about why put the third one, or if you didn't need it, and here's the results of the trial that showed the increased weight loss with the third balloon being added. All of the balloons have a 6-month limit on them, and that was something that was devised in the FDA trials because the fear is that over time the gastric environment could denature the balloon, and there could be some compromise of the material if left in too long. And so all the safety data was done with a 6-month time frame, and then that's where that came from. Now, I will tell you, overseas and other places, there are people that are putting them in for longer, or they're putting in a second session. They'll take them in for 6 months, out for 6 months, back in for 6 months, depending on what a patient's needs were. Those are usually when they're working with the higher BMI people that they're trying to bring down a lot. But I think what you're going to find is that's about the right amount of time to really get your body prepared and lower your set point, get you some good healthy habits going, and then we'll follow from there. Here is again the clinical trial study comparing balloon-only therapy, right, with no scientific-based nutritional program, and you can see the balloon patients did much better than the patients that were just placebo. So that everyone swallowed a capsule of something, and everyone thought, well, maybe I have it, maybe I don't. So this proved that it was effective. And here's that point. I think this is probably my favorite slide out of the whole thing, because what you're seeing here is key, right? So these people were followed after the balloons came out, and they didn't have weight regain. So that's the big difference between what else is out there and what you get with Obolon, right? You would be seeing this. And what we're not after aversion therapy. I'm not a fan of that. There's all kinds of stuff out on the market today that just to me doesn't feel right, right? There's things out that suck food out of stomachs, and it just doesn't seem like it's teaching the right thing to the patient. Because what we have to do, our duty to you at the end of the day, is to give you something that's going to help you make long-term lifestyle changes that's going to be healthy for your body. And we have to get advantage over that metabolic dysfunction that you have at first, because that's why you've had trouble all along. And once we get our foot on that thing and get it down, then these healthy habits have to stay in place. So we're not interested in putting you in misery or having something that makes you feel bad all the time, because that isn't teaching you anything other than just to get your Dr. Seeger voodoo doll out and stick pins in it because you're not comfortable. I want you finding something that makes you understand that you can feel okay with a small amount of food, and you lower that metabolic set point. You're picking the right things, you're making the changes, and that's the key. That's really the ticket. And that's true with gastric bypass. That's true with sleeve gastrectomy. That's true with duodenal switch. All of these very complicated things we do. If we don't teach a patient and work with them and get them practicing what's sustainable long term, they have risk for weight regain, right? So we're talking about something here that doesn't involve the cutting and the surgery and the pain and the time off, that can give you a leg up on that. And that's why it's exciting, because it's not aversion therapy. It's helping you build that new lifestyle. Who can get it, right? These are based on FDA programs. So we're looking generally for adults that are over 22. I'm not sure why 22 is a magic number. I think you can rent a car when you're 24. That's when like the frontal lobe is like fully developed. I guess the rental car companies decided that was the number, but 22 for this. BMI is recommended from the FDA of 30 to 40, right? And then we want the willingness to stick with the program, right? We want to teach you this and make sure you have all the tools at your disposal to be successful long term. Who is not a candidate? All right, this list is going to seem long, but it's not really. It's very simple. And if you've had a stomach surgery, not surgery on your abdomen, but if you had a lap band or a gastric bypass or a sleeve gastrectomy or anything on the stomach proper, where your anatomy of your stomach itself, where the balloons would live in that organ, is altered, then you can't have it. And the reason for that is a safety thing from the FDA. There was a higher incidences of stomach complications if your stomach had staples in it or had some sort of procedure done to it before. Doesn't mean there's not something at BMI for you to do. We definitely have things for you, but the balloon is not a good option. If you're taking medicines that cause ulcers, or you have a history of ongoing ulcer disease or stomach problems, we've got to be very careful with this. So we want to make sure that you're not going to have issues, especially if you have to take blood thinners for some reason. We want to make sure that having balloons in your stomach doesn't irritate and cause any bleeding. So we would want to be careful about that. Every patient that has the balloon in will need to be taking a medicine to help keep the acid level down while the balloon is in. And that's just so the stomach can stay healthy. It doesn't have that extra acid in there irritating, and that you don't have reflux and as much reflux or discomfort as you might have with a fuller tummy. If you don't want, or you're philosophically opposed to taking those medicines for whatever reason, there's been data coming out on people who take those medicines long term that can cause problems with your bones. We're not talking about long term, we're talking about 6 months. But you should be aware of that issue. We wouldn't want you doing something that you weren't aware of. And we'll go over your specific medical history when we sit down together and say, okay, this is good, this is an issue, we need to talk through this one. So there may be other smaller things, but those are the main ones to know. So getting started, right? We want to sit down with you, we want to get to know you, find out what your goals are, see how this fits, get to know your medical history, set some team goals for what we want to do for you, provide for you. and then get things on the schedule. We like to kind of book things out in advance because there's a series of appointments. You could see how it could be a little labor intensive at first if you're getting balloon, seeing Dr. Jenny, seeing our dietitians. There's a lot of work to be done, but I don't want you missing out on any of it because it's all equally important, right? Our tendency is to like focus on the thing, and it's not about the thing, it's about you, you know? We're here, this balloon is here, all the things are here gathered around to help you get what you want out of this. And it's a team effort. All of it needs to be taken together to get the best outcomes. So, again, overview. Some of these are a little repetitive, but we talked about these things. Crohn's disease, I don't know if anyone has that. That's another one of the things that can be prohibitive because it can cause intestinal complications. But we'll go over all this in the office specifically with you. We'll provide you with a lot of this information, but these are like, hey, if you're having any pain, if you're having any fever, or you're having a lot of discomfort or vomiting, anything like that, you should call us. One thing that I think is interesting about the balloon being filled with gas is that you need to be careful about altitude. If you fly in the airplane, you need to make sure it's like commercial, so pressurized cabin. You don't want to go up and you're going to do parachuting, and that's bad because the gas with barometric pressure can change the size of the balloon, and we don't want that. If you're thinking of moving to Mount Everest, believe it or not, it's possible. Yeah, you can live in Kathmandu, but you can't head up to base camp there without special permission. But scuba diving is the other thing, so going up and going down. So you don't want to do that while your balloon is in. Once it's out, you're good to go. We got any scuba divers? No? All right. Flying's okay as long as it's commercial pressurized cabin. In case of a sudden drop in air pressure, oxygen mask, no, I'm just kidding. But yeah, they usually go down pretty quick if there's a drop in air pressure, so it shouldn't be a problem. I haven't asked that question though. If the oxygen masks come on, should you be worried? So, but anything like that, ask. We'll answer the questions. This one is my favorite. Do not bite the tubing as it goes in. I mean, that probably seems obvious, but you could damage that, so we don't want you to bite it. So a little bit about the clinical protocol that the study was done. If anybody's interested, I can share that with you. You're going to have a consultation to talk about whether or not it's appropriate. We're going to put you with Dr. Jenny in her program, and that'll be monthly visits with them. That'll also include a staggered diet visit, so you'll see her plus a dietitian both once a month during the time the balloon is in. You'll also be following with the person that put your device in for you. We also include some of these extra testing modules like the DEXA scan. This is the thing that the Dallas Cowboys use. This is a patient of ours who had some therapy, and the red is the fatty tissue. This is like a color printout of you. It scans you and tells you what you're made of. And a year or so after therapy, everything pretty much had turned to that lean figure on the left. So this is what we're looking for, targeting areas to focus on, and we get very scientific with what we're doing about that. You'll get your insertions, right, the balloon itself, and also the removal, which includes the anesthesia and the facility where it's removed, all the endoscopy equipment, all that's included. This is the fluoroscopy suite where we'll take pictures of this balloon going down into your stomach and take x-rays. You can't see on this picture, but behind me on that wall there is a television that you'll be able to watch this yourself as you stand there and have this balloon inserted. So it's definitely a lot of therapy compacted into a short 6 months. What it is, I think, is, it's something to help you with a problem that is so vexing and frustrating that you've been left kind of doubting yourself and just really like, I mean, it's really not uncommon for people to come in and have a lot of feelings of, they're blaming themselves. They're frustrated. Oh, I just didn't do the right thing, or, I don't, didn't eat right, and I did this to myself. And you know what? It's if you don't remember anything else I've said, I just want you to take this message away. This is not your fault that you have a problem with your weight that you don't like. I mean, everybody can make better choices, right? You can always make better choices. But you can't change the genetics and the environment and the hormonal metabolism, all that medical stuff on your own. You can't do it. So you need something, medical weight loss, maybe medical weight loss plus Obolon therapy, maybe surgery is what you need. But something in there isn't working right. And even when you try your hardest, it's not working right. You lose some weight, you gain it back. We talked about that yo-yo effect. So I just don't want you to think that there's nothing there for you. It's certainly an option. It's an exciting option. And like I said, we've been sitting here waiting for this technology to emerge because we've known about it. But now we have it, and we'll be able to start putting these in January. So we're very excited to take the next step to help our patients treat this problem without maximally invasive component.